Welcome to Easy Anatomy. Let us talk about glossopharyngeal nerve, cranial nerve number 9. Glossopharyngeal nerve, as you know, again, widely is a mixed nerve. It means it has motor fibers, sensory, parasympathetic. When we talk about sensory, we have also visceral and somatic. This visceral either general from pharynx or special, which is test. General like from pharyngeal, mucous membrane, this general sensation. Somatic, again, like general sensation from tongue or palate. So motor, let us talk about motor. If you remember, the only muscle supplied by glossopharyngeal is stylopharyngeus. This is the only muscle supplied by glossopharyngeal nerve. Parasympathetic to parotid gland. Parotid gland. So let us talk about from the beginning. Here is the brain, medulla, spinal cord again, foramen magnum. Here is jugular foramen, where glossopharyngeal come out. Again, we have nucleus ambiguous, which give the motor root of this nerve, glossopharyngeal nerve, and this is going to which muscle? Stylopharyngeus muscle. The only pharyngeal muscle supplied by glossopharyngeal. The rest of pharyngeal muscle supplied by which nerve? Vagus, through pharyngeal plexus. Okay, then we have the spinal trigeminal nucleus, which is a common sensory nucleus for trigeminal, vagus, glossopharyngeal, facial, and you need to remember that it is very complicated nucleus, is not only limited to trigeminal nerve. So these fibers, which come from the posterior third of the tongue, general sensation going back to spinal trigeminal. There is also sensation coming from the palate, soft palate, from the soft palate, so posterior part of the tongue, posterior third of the tongue. Then we have the nucleus responsible for visceral sensation, taste, and general is nucleus solitarius. This is in the medulla. Again, you have taste sensation from the posterior third of the tongue is going to this nucleus. You have sensation from the pharynx going to this nucleus. So from the tongue, taste sensation. This is special sensation. And then from the pharynx, sensation go to this plexus of nerves, which is pharyngeal plexus. And pharyngeal plexus, the sensory root of it is glossopharyngeal nerve. So sensation, general sensation from the pharynx. Okay. Then parasympathetic, which we call it inferior salivatory nucleus. You will see that this nucleus is send the parasympathetic fibers, which go with the nerve through jugular foramen, then ascend to the tympanic membrane inner surface, form tympanic plexus, and from there lesser superficial petrosal nerve arise and leave cranial cavity through foramen ovale. is going to stop by otic ganglion, and the postganglionic fiber is going to join auriculotemporal nerve to reach to parotid gland. This is auriculotemporal nerve. So again, this fibers, parasympathetic fiber of glossopharyngeal nerve, is going with the nerve. So this is, everything here is one nerve. Everything here is one nerve, but different kind of fibers. This is one nerve, but different kind of fibers. Okay, which is glossopharyngeal. The parasympathetic fibers through jugular foramen then send this tympanic branch. The tympanic branch through small tiny foramen in the base of the skull go to the tympanic cavity, where it forms this plexus on the inner surface of tympanic membrane. This is, we call it tympanic plexus. And from there, glossalar superficial petrosal nerve arise and go out through foramen ovale, stopped by otic ganglion. Then postganglionic fiber go to auriculotemporal nerve and parotid gland. So at the end, you can see now the glossopharyngeal nerve distribution and the branches. Glossopharyngeal nerve go through jugular foramen, then descend through the neck in carotid sheath, then ascend forward deep to hyoglossus muscle. Is going deep to hyoglossus muscle, and give multiple branches. Motor branch to stylopharyngeus muscle. Here is nucleus ambiguous. What is the nucleus ambiguous? We talked about nucleus ambiguous. This is the stylopharyngeus muscle. Okay, this is the motor fibers. Then is going to give parasympathetic fiber to parotid gland. Receive sensation from the posterior third of the tongue, and as you see, two kind of sensation: general and test. General and test. The red one is test, the blue one is general sensation. And also receive visceral sensation from pharynx through the pharyngeal plexus of nerves, and then ascend again back until it reaches to nucleus soterius. So if I ask you what are nuclei related to glossopharyngeal nerve, you have parasympathetic nucleus, is called the inferior salivatory nucleus. You have motor nucleus, is called the nucleus ambiguous. You have visceral sensory nucleus, which is called the nucleus soterius, and the motor nucleus ambiguous. Then you have trigeminal sensory nucleus for general sensation. Okay. Keep in mind pharyngeal plexus. Pharyngeal plexus, this is a plexus of nerves located on the surface of middle constrictor. This is the location. It had middle constrictor of the pharynx. It has motor root from vagus to supply muscles of palate except tensor palatine, muscle of pharynx except stylopharyngeus. Then it has sensory root from glossopharyngeal nerve, sensation from pharynx, sensation. It has sympathetic root coming from superior cervical ganglion. This is vasoconstrictor to blood vessels of pharynx. So pharyngeal plexus is a plexus of nerve located on the lateral surface of middle constrictor of the pharynx, and it has three roots. Motor root from vagus, supply muscles of palate and the muscles of pharynx, except tensor palatine and stylopharyngeus. It has sensory root, which receives sensation from pharynx, sympathetic root, which supply blood vessels of the pharynx, vasoconstrictor. Okay, we have something called glossopharyngeal neuralgia, where patient can feel pain starting in sore throat, or they're referring to tympanic membrane because of tympanic plexus, and also can be accompanied by headache. So keep in mind that glossopharyngeal neuralgia will not limit it to pharynx only, but it can extend it to the tympanic membrane or ear, and also headache. Thank you.